As people get older, it's common to notice small changes in their bodies, feeling a bit more tired than usual, getting short of breath after climbing stairs, or experiencing occasional chest discomfort that comes and goes. Most people chalk these symptoms up to aging, lack of exercise, or a poor diet. But there is a hidden and often overlooked cause behind many of these issues that no one talks about: the very medications people take every day to stay healthy. Yes, the same pills millions of people over the age of 60 rely on, whether for pain, sleep, mood, or chronic conditions like diabetes, may be silently damaging their hearts. Over time, the side effects of these medications build up, putting extra strain on an already aging cardiovascular system. In this video, you're going to discover the most common medications that could be harming your heart right now. This isn't about creating fear or panic. It's about awareness and prevention. And make sure to stay until the very end, because the final category we'll cover is one of the most widely used and one that almost no one suspects as a heart risk. Let's start with one of the biggest silent threats: non-steroidal anti-inflammatory drugs, or NSAIDs. These include popular over-the-counter painkillers like ibuprofen and naproxen medications found in nearly every home. People take them for back pain, arthritis, joint inflammation, headaches, and countless other aches and pains. But here's the dangerous truth: these drugs can raise blood pressure, cause fluid retention, and place added stress on the heart. For older adults with even mild or undiagnosed heart issues, long-term use of NSAIDs can trigger heart failure or severe arrhythmias. Over time, they can also damage blood vessels and kidneys, creating a domino effect throughout the body. And if you're already on medication for high blood pressure or heart conditions, NSAIDs can make those treatments less effective. If you're relying on these drugs regularly, it's time to explore safer alternatives and never use them long-term without medical supervision. Now, let us talk about a category that millions of people with type 2 diabetes rely on every day: thiazolidinediones, with pioglitazone being a common example. These medications help lower blood sugar levels, but they come with a hidden cardiovascular risk: fluid retention. That swelling you notice in your ankles, feet, or legs may seem minor, but it's a sign your heart is working overtime to manage the excess fluid. For seniors already at risk of heart disease, these drugs can accelerate the development of heart failure. What makes it even more dangerous is how easily the early warning signs get overlooked. Extreme fatigue, shortness of breath after mild activity, or a sudden gain in weight could all be signs that your heart is struggling. While these medications are effective for blood sugar control, it's critical to discuss with your doctor whether there's a safer option available, especially if you've ever had heart problems. Next, let's address sleep medications, a category used by millions of older adults struggling with insomnia. Drugs like zolpidem, or even older ones like diazepam, offer the promise of a restful night, but the reality is far more complicated. These medications slow down the central nervous system, which includes your heart. They can artificially lower your heart rate and blood pressure, making it harder for your body to respond to stress like low oxygen levels during sleep. Long-term use can increase the risk of sleep apnea, a condition where breathing repeatedly stops and starts during the night. This, in turn, puts enormous pressure on your heart. On top of that, sleep medications can interact negatively with common heart drugs like beta blockers, creating dangerous fluctuations in heart rhythm. Older adults are also more prone to falls, confusion, and even respiratory issues when taking these medications. If you find yourself reaching for sleep aids frequently, now is the time to look for safer, natural alternatives and have an open conversation with your doctor. Another group of medications that deserves serious attention are tricyclic antidepressants, drugs like amitriptyline and nortriptyline. These are often prescribed to manage depression, anxiety, and even chronic pain. However, they come with a well-documented list of cardiovascular side effects, especially in people over 60. These drugs can cause irregular heartbeats, sudden changes in blood pressure, and, in severe cases, heart blockages that interfere with the electrical signals controlling your heartbeat. Even at low doses, prolonged use can be risky. Symptoms like unusual fatigue, dizziness, or feeling like your heart is skipping beats should never be ignored if you're retaking one of these medications. Thankfully, there are newer antidepressants with much better safety profiles for older adults. If you're currently on a tricyclic antidepressant and noticing any heart-related symptoms, bring it up with your doctor as soon as possible. Now, let's talk about a type of medication people use during cold and allergy season, decongestants. Ingredients like pseudoephedrine or phenylephrine are commonly found in over-the-counter cold and sinus relief products. While they work by narrowing blood vessels to reduce nasal swelling, they also constrict the arteries that supply your heart. This can cause sudden spikes in blood pressure and increase your heart rate. For older adults, especially those with hypertension or a history of heart disease, this can trigger palpitations, arrhythmias, or even heart attacks. The biggest danger with decongestants is their availability. People assume they're harmless because they're sold without a prescription. But as you age, your body processes these chemicals differently. If you're prone to heart issues, always double-check labels and talk to a pharmacist or doctor before using any over-the-counter cold medications. Another surprising category is acid reflux medications, specifically proton pump inhibitors or PPIs. Drugs like omeprazole and pantoprazole are widely prescribed and even available over the counter. While they're great at reducing stomach acid and relieving heartburn, long-term use can interfere with your body's ability to absorb essential nutrients like magnesium. Low magnesium levels are directly linked to dangerous heart rhythm disturbances, muscle weakness, and extreme fatigue. On top of that, PPs can alter your gut microbiome, leading to increased inflammation throughout the body, another risk factor for heart disease. If you've been on PPs for more than a few weeks, it's time to discuss with your doctor whether continued use is still necessary or if lifestyle changes could help manage your reflux more safely. Lastly, we need to talk about calcium channel blockers, a common prescription for high blood pressure, chest pain, and arrhythmias. Older versions like verapamil and diltiazem can relax blood vessels and lower blood pressure, but they also slow the heart rate significantly. This can lead to extreme fatigue, dizziness, swelling in the legs, and in more serious cases, dangerously slow heart rhythms. When combined with other heart medications, the risks multiply. One of the biggest challenges here is that the side effects often mimic normal signs of aging. Many people accept feeling tired or lightheaded as just part of getting older, when in reality, it could be a drug-related side effect. If you're on one of these medications and experiencing any unusual symptoms, it's time for a medication review. Before we wrap up, here is the most important takeaway. Never stop taking any medication suddenly or without talking to your doctor. Every medication has its place and purpose, and for many people, the benefits outweigh the risks. But being informed allows you to ask better questions at your next appointment and make safer choices for your heart health. Sometimes the solution is as simple as adjusting your dose, switching to a newer medication, or adding lifestyle changes that support your heart. If you found this video helpful, please share it with friends or family members who might also be at risk. Taking control of your health starts with understanding how your medications could be affecting you. Thanks for watching, and take care of your heart.